So I think we'll start. Hello, everyone. My name is Julie Mann, and I'm a nurse midwife and Associate Director of Midwifery at Seed Global Health. Thanks for joining us today. We're really excited to have you and then those who will be joining us on the recording. We plan to spend the next hour discussing the importance of investing in midwives globally and strengthening midwifery education. As I'm sure many of you are aware, we have a global shortage of nurses and midwives. WHO estimates that to reach the Sustainable Development Goal 3 on health and well-being, we need an additional 9 million more nurses and midwives by 2030. Midwives are a significant component of this. Midwives are essential. They are often the link between women, their families, and their communities. And they're often the first face that many females encounter in the healthcare system. Today, as we speak, more than 800 women are dying from preventable causes related to pregnancy and childbirth, the majority in sub-Saharan Africa. There is a solution to this unacceptable reality. And the solution is investing in midwives. According to WHO, if women have access to quality midwifery care, over 80% of these deaths could be averted. In order to secure midwifery care for all women, we must invest in their education of midwives. This is one of the guiding principles of Seed Global Health. Seed aims to educate a rising generation of midwives by partnering with academic and health institutions in sub-Saharan Africa to strengthen midwifery education, enhance clinical practice through mentorship and training, and advocate for midwifery policies. One step in achieving these aims is by placing midwifery educators in one-year positions at our long-term collaborative partnership institutions in order to share midwifery teaching and clinical expertise with students, clinicians, and faculty. And today, we're fortunate to take a deeper look into what this investment in midwifery education looks like with Seed. We have two former midwifery Seed educators. We have a midwife from one of our partnership institutions in Uganda. And we have a midwifery intern who has benefited from this relationship between Seed and our in-country partnerships. We'll chat with each of these panelists to explore what it looks like to be a Seed midwifery educator and to be an integral part of this movement to invest in midwifery education. So I'd like to introduce our panelists. We have Anna Grace Oma, who is a clinical supervisor in nursing and midwifery at Lira University in Uganda. We have Kathy Beach, who is a former Seed midwifery educator who was in Malawi at Kamuzu College of Nursing. We have Deanna Garde, who is an alumni former Seed midwifery educator who was at Lira University in Lira, Uganda. And we have Rosemary Napiok, who is an intern midwife at Lira Regional Referral Hospital and who was a student with Deanna Garde when she was a midwifery educator. So welcome all of you and thank you for being with us. I just wanted to let you know the format of this. We'll be talking with the panelists and then we'll leave 15 minutes or so at the end for question and answers. And we ask that if you have questions that you type them into the chat box and we'll be monitoring that and we will ask the panelists those questions. So let's get started. So maybe Kathy or Deanna, if you could just start us off with telling us what it was like to be a Seed educator and what your work was like.
Sure, I can start. For me, being a seat educator was wonderful, of course. And my job was twofold. The first part of the job and the major part of the project was to help launch a midwifery-led ward at a large hospital in Blantyre, Malawi, called Queen Elizabeth Central Hospital. Blantyre has a population of about 800,000 people. And so the idea came from the midwives who work at Kamuzu College of Nursing. They'd wanted for quite a few years to have a section of the hospital, labor and delivery, that was run completely by midwives. The leaders would be the midwives, and they would take care of all the normal births. So that was their dream, and I was there to help get that dream going and launched. And then the second part of my job was teaching the midwifery students who would eventually be working on this ward and be part of the solution to the lack of midwives in the country.
And Deanna?
Yeah, thanks so much, Julie. So I was at Lyra for the academic year, and for the most part doing teaching in classrooms. So every semester we would, myself and my counterpart for the third year students would teach a few classes and then do a little bit of fill-in as well for other professors when they needed an additional hand. So mostly beginnings of midwifery teaching. I apologize for noisy town here. So the beginnings of midwifery teaching, and then like normal and abnormal, some reproductive health classes. And then at the end of the semester, we would do our clinical rotations. And so that was a really lovely part of follow-up. So following the students to their practical and spending the day with them in the labor ward or doing family planning or antenatal clinics, whatever it was for that semester. And then having the opportunity to do both, to take students into the field, to do more rural midwifery, and then some time at the district hospital as well. There was a really nice, there were opportunities to do additional projects as well. So we were able to write proposals to get some funding for example, we initiated and then led a mentorship program. And that was taking students from the local high school and matching them with midwifery students. And then every month we would get together and have some topic that we would follow up, a lot about empowerment and reproductive health and also other things too, just life skills, really. And so that was a really nice link for the community to see what students do in the school and to have a role model and an example for them. So that was a really special project. And then another thing that we did was work on setting up a skills lab, which was quite a large project, but also really fun and really fulfilling. So if anybody has questions about that, happy to answer. We did a lot of work together, and I think we made a lot of progress. There was not a third semester that I was there, but another portion of time after the second semester that we did domiciliary, which is the students in third year go out into the field and do home visits. So they do 10 home visits for every woman who's delivered at the hospital. And then we accompany them on the 5th visit and then their very last visit for their closing out. And they get graded, but we also had an opportunity to do one-on-one support for them. And seeing people in their homes, a whole different dimension. And that was really special. So it was a really broad experience that we had together and very, very fulfilling. Thanks.
Great. Thank you. So, a lot of potential midwifery educators who have thought about applying and sort of asked me, what does the job look like? And as you can see from both the different answers from Kathy and Deanna, it varies from site to site, but it's sort of all encompassing. And the job description might be one thing, but then it expands when you get there, I think, to many different wonderful projects. And could both of you share with us a typical day? I know it varies, but Kathy, what was your typical day? I know it involved a little swimming sometimes, and so there is leisure time.
Yes, it was a busy day, usually a very busy day, but certainly time for leisure as well. I just have to say, every day began with a beautiful 30-minute walk from my home to the university. And Malawians greet each other like you wouldn't believe in the morning. You know, not just good morning, but how did the dawn greet you? You know, just wonderful greetings like that on my way. And so I would be greeted by quite a few people on the way because all of us walked in the morning. And then when I got to the university, my office was on a hallway with other faculty members. So more greetings there before we started our workday. So very friendly. I would say Malawians are one of the friendliest group of people I've ever met. So there was a real sense of camaraderie. In Maine, I work almost alone. You know, there are very few midwives in Maine. But when I got to Malawi, I felt this sisterhood of so many midwives working together on this one goal to get a midwifery-led ward started. So my day usually started with teaching in the morning, teaching the students who were direct entry midwifery students. They came usually right from high school, and they were going to be midwives because they had identified that as the job they would love to do. And the lack of numbers in Malawi meant that this direct entry program would get more midwives into the workforce sooner rather than having everyone go through a general nursing program first. So teaching in the morning, and then I would usually after teaching go over to the hospital and check in with the midwives there, because my teaching was not only in the classroom but also, like Deanna, we would do clinical teaching on the wards in the hospital. And so I always wanted to know what was going on, what had happened since I was there last, and how to just keep up with what the protocols were on the hospital, in the hospital, so I could teach the students up-to-date information and just kind of know what was going on. And then the afternoon usually would involve a meeting because we had a lot of stakeholders to get the midwifery-led ward started. So there would be stakeholders from the hospital and then people from the faculty of nursing. And so those were like sometimes brainstorming, sometimes working specifically on policies. And then I also would set some time aside just to work on lectures for the students, or, you know, getting clinical teaching sessions set in my mind. And then, yes, I did swim almost at the end of every day. There was a beautiful pool at the university. So I would, on my way home, stop off and take a nice swim, looking out at Mount Sochi. Oh my God, beautiful.
Great. Thank you. Deanna, what about you? What was a typical day for you?
A typical day usually started with an ambulance ride because that's my mode of transport. And I actually really loved that. So George, the ambulance driver, would come and pick me up from I lived on a small compound with maybe like 8 houses in the compound. He would pick me up from there and we would drive to the school. The school's very rural, so it was not even in the town of Lira proper, but outside. So maybe like a 20-minute drive. And then we would have classes. It really varied depending on where we were in the semester. But we would either have our classes and spend the day at the school doing that, or doing planning. Lira, the midwifery program at Lira University was quite new. So I think Rosemary can correct me, but I think we were in the 3rd year when I was there. So we were still doing a lot of like processes and doing planning, class planning, and so we would spend some time doing that, my counterpart and myself. And, you know, usually on the way home, George would pull over so that I could pick up some fruit or some food. And then I would do my own cooking and everything at home. If it were a clinical rotation day, then I would get picked up as well. We would go to the school and pick up the students, and myself and George and the students would drive in the ambulance to the clinical site. And for the most part, we would spend the day there. And when we were doing domiciliary, going to homes, it was really busy. We had about 70 students. And so trying to oversee the students and give them support in the field was really quite a large task. So oftentimes we would come back in the evening, in the dark. But yeah, so it was really, our days were very full and very busy, but always good. Yeah, we always had good food and good company, and we kept ourselves busy.
Great. Thank you. I guess I'm just curious, there's a lot of interest in midwives, and a lot of midwives are saying, at some point I want to, be a seed educator, and the draw is there. But what drew you to actually apply and say that this is the right time and this is exactly what I want to do? What was that draw for you to be a seed educator?
For me, so I had been in Sierra Leone prior to that, and I had always wanted to do some kind of international work, but I had a child, so I waited until he was grown and had physically moved out of the house. So when he went to college, I thought, okay, this is something that I can do. And so I spent a year and a half in Sierra Leone, and I think it must have changed my brain chemistry or something, because I came back and I worked for a year back at home, almost a year, and it just wasn't, I just kept thinking about international work. And so when I found out that SEED had this program and that it was a mixture of both teaching and then being also in there, I think there were 5 countries at that time that the program was running, it just felt right. And I felt that I had some things to offer, but I also felt that I had some things to learn as well. So I think it was a really nice mix. And yeah, it was quite perfect. The timing in my life was really good, and the location was lovely. So I think that's what drew me to the program.
I think for me, it was also a matter of timing. I think when we go through life, opportunities come, and you either grab them or you don't. And I was kind of winding down my career in midwifery here in Maine, and I had worked in Kenya as a young 20-something, first as a Peace Corps volunteer, and then several years beyond that. So I had spent in my 20s, 4 years in Kenya. And so that experience was one of the best things I did in my life. And so at the end of my career, I had this desire to go back to someplace new and just experience another culture. And as an experienced midwife, I was hoping I would have something to offer. And it was actually word of mouth. A former seed educator, my good friend Linda Robinson, is the person who told me about this seed educator opportunity in Malawi. And so I applied myself and was accepted and just got excited about it. And so I was able to talk with Linda a lot before I went about what the job would be like. And she was, a real good source of information. And since then, SEED has really expanded how you can get information. I know Dan's putting in little links to how people can find out more about being an educator. And, I think everyone has to decide for themselves when it will fit in with their life. But for me, it was perfect timing. I was just really ready to go. I felt like I still had some midwifery energy in me, even after working here in the States for many years.
Deanna, you said something that caught me, and both of you said, I felt like I had something to offer from your midwifery experience, but you also had something to learn. And I'm curious, what do you think both of you learned during this time? I know that there's many, many things, but if you could sort of pinpoint 1 or 2 of them.
For me, I think it was just getting a bigger picture of what midwifery globally is. When you're working in your own little part of the world, you don't have that wider lens. And so for me to see midwifery, at least in Blantyre in Malawi, it just allowed me to just plug more into what midwifery is, or, in another spot from where I had been before that. And just, I think I've said it before, this sense of sisterhood, like we're all in this together, was really, for me, just a real great take home message. And it just made me more excited about the job.
Yeah, now what about you? What do you feel like you learned?
Yeah, I think for me, one of the things that made me the most frightened was teaching. So I went to Lyra as a new teacher, and I actually, yeah, I was quite nervous about it. And I had a lot of, I had a lot of moments where I thought, what am I doing? I've never taught before. I don't know how to do this. I had the experience, but I didn't know if I could actually make it work in the classroom. And so this was one of the nicest surprises for me, is that it was okay. It was lovely. And I learned a lot in the process. It sort of used a different part of my brain. I like to be quite organized, and so I felt like I was able to bring that to the table and learn how to teach at the same time. The students were great. I felt like I got feedback from them, and so I think it was a kind of a mutual relationship between them and myself. And so, yeah, I think teaching, if you have the skills, the clinical skills, I think it's quite nice to be able to carry that over into the classroom. The other thing I'll say is I think that it doesn't matter where you go in the world, there's always this initial time where you're adjusting, you're sort of trying to get used to how things are culturally, how things are different. And then I love when you reach that moment where you feel like that those differences get smaller, 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 and then you just feel like you're there together, and like, Anna feels like my sister, and my students feel like my sister, my brother, like, and it sounds a little corny, but it's true. And I love when those differences disappear and you come together closer. So it doesn't matter how many places you go to, that's always a little bit of a blessing.
Yeah, that's beautifully put. And part of the reason I think why SEED, a lot of midwives say, well, can I go for a shorter time period? A couple months, or it's hard to take a year away. And but I think that's one of the reasons why, is not only because we want, SEED in and of itself has this commitment to this long-term commitment over many years, but we want the individual educator to have a commitment to the institution and their colleagues and their students, and that takes time to develop. And with that time comes great benefits, as you described. And so, any specific challenges that you encountered, as I'm sure there were bumps in the road, but anything that stands out that you had to address while you were an educator?
Oh boy, yeah, there are many. So I can give two examples. One is just, I'm a pretty flexible person, but the sense of time was so different than what I was used to. Like, there are so many transportation problems, for example. So if a meeting was supposed to start at 2, it never started at 2, and I just had to let go of that. Or if we needed to have a document in by a certain date, there would be Wi-Fi issues. We wouldn't be able to get on, and so those things never happened on the date they were supposed to happen. So I just learned very quickly I had to go with the flow. Just, it's okay. This doesn't have to happen exactly at this time, and it was good for me as as a person who wanted everything to be on time. I just had to let go of that. And then the other thing is just the incredible numbers of births. The first day I was at the hospital, I could not believe how hard these midwives were working. At Queen Elizabeth Central Hospital, there are 40 births on average a day. That is like mind-boggling. And I saw that because we didn't have the numbers of midwives that we needed, many women would give birth unattended. I went home the first day crying. There were 3 newborn deaths and 1 maternal death. I was just overwhelmed. So I was so committed to seeing where I could plug in to just see what might my role be for the year that I was planning to be there. So I just had to kind of open myself up, almost like a wound. You just open yourself up and say, okay, I'm here. I'm just going to be open to whatever comes my way. And so even though I went home crying a couple of days a week, sometimes at the very beginning, just getting used to the overwhelming numbers of women giving birth unattended. I just was really sad about that. And so I think having the support of the faculty and the midwives at the hospital, just learning as much as I could, as fast as I could from them, made things turn around. And as Deanna said, you just become closer and closer. I mean, these are lifelong friends now, just because we've gone through these things together. So.
Thank you.
Yeah, I think for me, so there are two things come to mind. One is that because it was a fairly new school, there were a lot of still kinks that people were working through. And so I think there was a lot of effort that needed to be made to sort of organize the classes and make sure that people knew who was doing what and it wasn't redundant and we weren't leaving big gaps. So that took a lot of work, and it did feel frustrating at the beginning, but it was also one of the things that I felt most proud of at the end. That may sound simple, but having achieved like a schedule, a class schedule that people followed, that was appreciated, and that also could be sustainable, that somebody could carry over to the next quarter and the next quarter, felt really good. The other thing is that being a faculty member, and being at the hospital for clinical rotations, you're not a staff nurse, you're not a staff midwife, you're faculty of the school, but you're there with the students, you're sort of in between. And so your role is, like, there were times that I saw things that made me really upset, but I didn't really have a place to step in and say something in the moment. You could say like gentle things, but you couldn't really stand in with any authority, I guess. But it gave opportunities to pull students aside at the end or after that event and just say, look, you know, how did you feel about this? How would you have dealt with it if you were the midwife in charge? You know, what are some things that you could do to make that situation different? So you can adapt and you can still have some, like, you can still discuss it and maybe have some, create some change, but you can't do it as an authoritative figure in the hospital, I guess is what I'm trying to say. So that was a little bit difficult, but, you know, but I think we did okay. Yeah.
And moving on from challenges, what's one of your joyous memories or moments? Again, I'm sure there are many, but what are ones that stand out?
Yeah, for me, yeah, I have a lot. There were a lot. I loved my students so much. But one of them, I think, and I bring this up quite often, is in one of the rural health centers. It was kind of a quiet day. There was not a lot going on. So we did our ANC visits and then we sat down and watched a video. Rosemary, I don't know if you were there or not. We were watching a video. I had my laptop and we kind of were sitting around huddled outside. And then we heard all of this ruckus, like all of these women, and so we stood up and we were trying to figure out what was happening, and somebody was delivering outside. She didn't quite make it to the delivery room, and so all of these lovely women, they took off their wraps and they held them up so that people gave her some privacy so that people couldn't see, and our students just bolted into action. And lovely, and we delivered this baby, and then the students took care of the mama and they carried the baby in. Like, that to me was just, that was really great, and I'll always remember that memory.
Wonderful, a proud teacher.
Yeah, I think for me too, the teaching is just, that stands out. You know, the students were wonderful. They were such eager learners, and just the last day I was there, we had a Yankee swap. And it was just so much fun. They just got into the game of it. And I just had such a good time with the students. Each one of them was really special. They all had their great points. And I got to know them pretty well. It was a small class that I had. I was teaching the first year students for the most part. And just so wonderful to see these eager learners. And I think for me going in, of course, you're nervous when you go in for a new job, but in the end, you just make all these great friends. And I know this midwifery-led ward is going to become a reality. We didn't quite get it launched because of, COVID and all that, but it's going to happen, and we all have faith that it will. And so just having those people on board and all of us going towards this goal is wonderful. So we need people out there who are going to go help do this.
Yes, thank you. And I guess before I move on to Anna Grace and Rosemary, just curious, you both were SEED educators and have moved on, and where have you moved on to, and how do you think being an educator got you to that place?
Yeah, I can go first. So I think that the midwifery world is quite, internationally, it's quite a small world. And when you get the opportunity to work in an organization like SEED, you meet a lot of people, and the people keep surfacing in your life. Like when you're done, you still maintain those relationships. And then you meet people that they know, et cetera, et cetera, et cetera. So I think that I was very, very lucky to meet somebody through this small SEED community who just kind of reached out and said, look, there's this position that I saw, if you know anybody who's interested. And I ended up applying for that. And that was a UNFPA position in Bangladesh. And so I got it. And so I moved straight here when I was finished in Uganda. And then, and now that was a year. I spent a year with UNFPA, and then now I've been a year with WHO, still in Bangladesh. And I would not be here had I not been in Uganda with SEED. And still I maintain those relationships. So it's been really, it's really catapulted me into a different place in my life. And I've really appreciated that.
And I guess for me, I just finished my SEED contract in July. So even though I came home a little early, I still continued to work remotely and worked on the project until July. So I actually took August just to enjoy summer in Maine. I've been enjoying just being outside and being on the water and just doing things that I love. But I think because SEED has given me kind of this wider lens, I'm working with fellow midwives here right now, working on social justice issues, and it's directly related to getting that global view through SEED, that I want to work on anti-racism. I want to get a new administration in our White House so that women and children get the care that they deserve. And so I'm working now, I think, again, from a kind of a wider perspective. My practice here in Maine was in private practice, full scope midwifery, but that was, a very concentrated thing. And now I think SEED has allowed me to just look at the bigger picture. And also because I'm older, I think I have that ability to look at a wider picture. So I'm not sure what the future will bring, but right now social justice is kind of up on the screen for me, and the next 2 months are really important for our country, and so I want to really work on that from here.
Great. Thank you both so much for sharing your stories, and I'm sure we'll get back to you with some of the questions that the audience has. But I want to move on to Anna Grace and Rosemary. And Anna Grace, let's start with you. Anna Grace is, as I mentioned, a midwife, and she is one of the associate directors of clinical midwifery at Lyra University, and worked closely with Deanna, and is one of our go-to point persons in our partnership in Lyra. And Anna Grace, could you tell us what it is like to be in partnership and collaboration with SEED, and what it means to the midwifery program?
Thank you, Julie. It's a pleasure being here, and I am glad I'm meeting Diana after a few years too, I think. I didn't think I would see her physically again, but here we are. We've been with Seed in Lira for the last 5 years, I would say, since 2015. And I must say, for the most part, Seed has contributed quite a lot in developing and making sure the midwifery program at the university runs smoothly through their support. With the partnership, we've had a number of seed educators, and believe me, each seed educator comes with a new experience, and these experiences keep piling up. At the end of the day, we are the richest with a number of experiences from each of the seed educator. These educators bring us a lot to learn. Yes, I know they learn from us, but we also learn a lot from them as faculty. Because we work with them close enough as partners or as counterparts, then we get to learn, first of all, how they do their things. It's quite different from how we usually do our things. From scheduling, from teaching, from the clinical experience to interaction with the students. And that has given us a lot to learn. For example, when I met Diana was from school, we ran through the domiciliary field attachment, and it was crazy. But uniquely, we had this very nice schedule that at the end of the day, you've seen quite a number of mothers and students, and you still have some energy to get you back home. And tomorrow you wake up fresh and you want to start again. Believe me, without a very good schedule, we wouldn't have managed that, and we were quite few. That is one of the memorable time with her, and I don't think it will ever go. Apart from that, I think seed educators ease our work a lot. When they're in place, yes, you're teaching, but you have a counterpart who is taking half of what you're supposed to do on your own, and they make the work a little lighter. The interpersonal relationships developed is kind of different from what we would have as in-country faculties. It's quite unique, and therefore communication with the students and amongst faculty becomes different. It's quite hard to actually mention it in words because the feeling is really different. Currently, we are running yesterday and today we had a team from National Council at the in-country regulators that regulate the higher education. They have come to accredit a master's in midwifery program. And believe me, this initiation was done by Diana when she was here. We had a proposal. She contributed a lot into making that proposal, and therefore, finally, we got a seed involvement, and they're supporting the program. Thank you. I'm bringing this up because I want us to realize that it's not just a matter of having a seed educator come to teach, but it's a matter of building us, the local faculty, in so many ways that you can sit down and write a grant because you've shared it with a counterpart or someone who has been with you for a short time. You can sit down and make a very good organized place of work, and that is not an individual initiative. And I am grateful to SEED and the SEED educators who have been with us so far, and we hope for many more to help us move to the next level. Thank you, Julie.
Thank you, Anna. And I think what you highlighted is really what SEED, what the mission of SEED is to establish these partnerships where everyone is learning from each other and growing, and that even when Deanna leaves or Kathy leaves, that the impact remains and the project still, the work still continues way beyond that individual person. And you just explained that beautifully, so thank you. And I want to get to Rosemary, our midwifery student, now intern, which is why we're all doing this, is to make more wonderful midwives. And Rosemary, before we go into sort of your relationship with a seed midwifery educator, I always think it's really interesting to hear why every midwife became a midwife. And can you just tell us quickly about why did you want to go to midwifery school? Why did you want to be a midwife?
Yeah. I am pleased to be here today to share with you. I hope you're getting me. Are you getting
Yes,
me?
we are. Mm-hmm.
All right, that's good. I'm very grateful to be part of the team that is discussing here today. My passion for, first of all, I started as a nurse. My passion to be a nurse started way back when I had a sick father, and I took a full responsibility of taking care of him. So when he passed on, I realized I had a lot of attachment to taking care of the sick, and I went on to join the nursing profession. Later on, I worked as a nurse, and in 2013, I was working in a Panel Center 3 in the rural community. And in that facility, I was more on the nursing side. So we would always realize having very many patients on the nursing side, on the general medical side. I worked in pediatrics, I worked in medicine, I worked in surgery, but I had no chance to work in maternity or have the time to take care of the mothers. So on the side of the midwifery department, we had midwives who were very few. And in a month, you would realize we have so many ANC attendants, but at the end of the month, you have less than 10 deliveries. So we took initiative to find out why exactly the problem was. Why was it that we're getting so many ANC attendants, and yet we had very few mothers coming to deliver in the facility? So we organized a community dialogue with the community. We invited the opinion leaders. We called it the traditional birth attendants, and we also involved the traditional healers and a few technical staff and the sub-county. So during the discussion, we realized there were so many things. First of all, the main reason why we called for that, we wanted to know from the community itself, what was the problem? Why was it that these mothers were not coming to deliver in the facility, and yet they were too close, the services were available, the midwives were there? So we realized most of them were bound by the traditional practices, and many of them had a fear of coming to deliver in the facility because they did not know what was happening in the health units. And so with that, we got a rich knowledge, a good information about why these mothers were not coming to deliver in the facility. So that was enough to give me the passion to say, yes, these mothers, people in the communities lack information. And if we had a chance to provide them information about the benefits of having a safe and a skilled delivery, then they would be in position to come and demand for the services in the health facility. So that is why I took the passion to come and join Lira University to do midwifery in 2015. This was all because of the passion that I developed for women's reproductive health. I felt the need to support these women and their families during pregnancy, childbirth, and puerperium, just as I was supporting the general patients. I felt there was need to create a positive environment, a safe environment for these mothers to have their childbirth, and also be a voice for these helpless mothers who are bound by the traditional practices that are very harmful to their health. Thank you.
Wonderful. Thank you for sharing that. And welcome to the sisterhood, as Kathy said.
Thank you.
So, what was your experience with the seed educator, and how did that impact you?
I must say that my experience, as Rosemary with the seed educators was so interesting. It was very positive and a memorable one. One can live to remember it, and I will always refer to it. And every student and staff at Lira University will always live to appreciate the experience having the seed educators and Lira University. I would go to the classroom experience. Our learning environment was very good. It was very interactive, very friendly. We had all the learning materials provided to us by the seed educators in form of videos, in form of books. We had pen drives. All these motivated us. And for a seed educator, they treated a student as an individual. They wanted to know each student as an individual and wanted to know their weak points and their strong points, so that at the end of the day, they're able to support all the students and not only look at those who are excelling in class and ignore the rest. They so much encouraged us on research and evidence-based practice. So these, remember in midwifery, there are so many things that are changing every day, and getting to know getting to know what the practice in the developed countries and the practice here at home help us a lot to conceptualize and also be able to provide good quality services to our patients. Then the schedules. As Diane said, our day was so hectic. Indeed, it was very hectic, but trust me, she made it so easy because she provided a schedule every beginning of the semester. We had all the learning materials that we needed. All our assessments and revisions were done in time and feedbacks given. All these created a very good learning environment and helped students to comprehend the theories. Remember, one thing is being able to take the information. There are very many students who learn in very many ways. There are those who learn by hearing, there are those who learn by seeing, there are those who learn by doing. So when you put all this together, then you realize your students are going to benefit at individual levels because we are all different. Then during the clinical experiences, it was an interesting one. It was hectic, but everything went on well. We had both facility-based, meaning we could go to the hospitals, then we also could go to the communities. While in the hospitals, we would go to health centers, we go to the Regional Referral Hospital, and all these helped us explore and compare the care that is provided to mothers, both in the main hospitals, in the local facilities, and in the communities. The most interesting moment Diana just said, where we had and went to an health center and bumped on a mother who was pushing in the compound, and everyone was so vigilant enough to make sure that they reached this mother and supported her to have a safe delivery, even though it was outside the labor suit. That was so interesting. And also, I must say, during our clinicals, at all times, our educators helped us to translate theories into practice. Whatever we learned in class was always what was recorded in the practical area. So we felt there was need for us every day to relate our theories into practice. We had scenarios, we had emergency drills on a neonatal resuscitation, on a emergency obstetric care. All these put together helped us in the clinical area. Then we also had a very good encouragement using the limited resources. Uganda is one of the countries that has very limited resources meant to provide care to the mothers. So we realized that even with whatever was there, Diane helped us utilize it in the most appropriate way. If it meant you don't have a screen in the labor suite, you must find all means of providing privacy. Either you send off data attendance or you use yourselves as a screen during examination. All this was very interesting. I think no one would think about it, but it was such a creative moment. And our clinical supervisions were so wonderful. It was not on fault finding. Usually students fear their mentors following them in the clinical area. But I must say, it was a very interesting moment, and we felt every day, if we could have our clinical, our seed educators, our tutors, our lecturers following us in the clinical area, then we'll be in position to do the right things. It was a moment that was so interactive, a moment that every student yearned to have an educator, a seed educator around them, a lecturer around them, helping them to do the right things. Then the other thing was the community. The community was so lovely, was so welcoming to us. First of all, the time of domiciliary, it was an interesting moment. We thought, first of all, the domiciliary, personally, people used to say domiciliary is very difficult, these mothers are very difficult, it's very hard to follow them up. But the 7 days of following up these mothers became so interesting, so easy. Everything was laid the right way. We had a guide on how to follow up these mothers, and we made sure we followed this up. We discharged our mothers. To be very honest, I must tell Diane today, up to today, those mothers still give us phone calls. They appreciate it. They update us on how those babies are doing. This already gives us the courage to continue being good midwives. It was indeed a wonderful moment. Professionalism, I must say, the seed educators were our great role models. Every student that graduated from Lira University and currently doing clinical internship refers to Diane as a role model. And everyone is proud about her because she mentored us in a professional way. We learned a lot of professional ethics. She taught us good communication skills, good leadership skills, decision making, above all, respect for diversity. This is sometimes something that is very difficult for a student to take up, but if every day you're reminded on your role, on what you're supposed to do, you have somebody whom you always refer to as doing the right thing, then you find yourself excelling every day. So this, honestly, has helped us a lot. Students were made to understand their role as midwives. Remember, if we are to provide good quality care to our mothers, to the mothers in the communities, to the families in the communities, midwives must understand their role. What are they supposed to do in order to save life? So we got all this every day in our lives, every day as we leave the lecture room, every day as we leave the clinical area. We knew we had a role to play in order to help these mothers, in order to help the patients in the community. I must say, up to today, we draw back this experience from you, and we are very grateful. And this is going to help us improve the quality of maternal and sexual reproductive health services that we are going to deliver to the country in a bid to reduce maternal mortality and morbidity. Mentorship experience. She had just told us she had a program of mentors. Indeed, Diane was a founder of a Dream Nurture Mentorship Program. This was meant to bridge the gap between the community and the university. So this helped students within the university. First of all, students were trained on mentorship skills, and then they were sent to the community schools. We had the secondary schools to mentor young students on so many issues about life. A few of them was general life skills, sexual reproductive health, leadership skills, career development, social life, and entrepreneurship. All this was meant to help inspire young people to look at life in a positive direction and be able to demand and be productive in the nearby future. So that is indeed how we appreciate and how we live to remember the services that the seed educators have left behind. It will remain in us, and we shall continue to practice them. Thank you.
Rosemary, thank you so much. wonderful stories, memories, and impact that Deanna has had on your career, and it sounds like, as Deanna shared, the same that you had on hers. So you know, we're running out of time here. We're reaching our hour, and there are a few questions in the chat box, and I'll quickly get to some of those, but I am putting here in the chat box, we also have our Seed Global Health website link, and then myself, and if we can't get to any of your questions, you can feel free to email me and I will get back to you. But a few things, maybe Kathy, since you just went through it quickly, someone wanted to know about what kind of orientation you have as a new educator. Do you just want to quickly address that?
Sure. There is a week-long orientation in Boston. The SEED office is in Boston, and all of us who were going to Malawi and Uganda last year, so this was in July of 2019, I had a week together in Boston, so we got to know each other. There were people from Seattle, California. I'm from Maine, and we all worked together on different things that we thought would be helpful for us as we were going to these new places. So that was a wonderful orientation, a whole week. And then when I got to Malawi, there was another week of orientation in the capital city of Lilongwe. And again, we were all together so that we were oriented to the country and a little more specific about where we would be in our particular jobs. And I saw that someone asked about how many people in one site. So in my particular job, I was the only one doing that job, but because it was a specific project for one person, but there was a person working with me who was a nurse practitioner in pediatrics. She and I actually shared an office, so we got to be quite close friends. And then there was a physician who was an OBGYN, and she was working in the same hospital. So the three of us actually saw each other quite a bit. But usually you're placed by yourself for a particular project, but you might be in city with other people. So I think each situation is a little different, but that happens to be what mine was. But there is, I would say, a very adequate orientation. Everybody, like Dan and I, both like, oh my God, what have I got myself into? When you first go, you think, yikes, this is a huge job. And you're, you know, of course, all your sort of feelings of inadequacy come up, and you feel like, oh, am I going to be able to do this or not? But it works out, you know, as you get into it. I'm sure everybody does their job a little differently. There's nobody saying you should do exactly this. You kind of figure it out for yourself as you go along, your strengths, your weaknesses. So you maximize your strengths and kind of say, okay, this part of the job isn't quite for me. So you have choices about what you can do when you get there. There's quite a bit of flexibility.
Is a resource for you, both for any cultural or any issues that you have just in terms of your placement, but also in terms of you know, any needs that you might have. So I think we addressed, you know, a few of the questions in the chat, but as I said, you know, please, if you're considering this either now or in the future, please take a look at our website at cglobalhealth.org, and feel free to email me and I can answer questions. I can get you in touch with any of these amazing midwives. And thank you. Thank you, Kathy, Deanna, Rosemary, and Anna. Thanks for all the work you do and for taking time to share with us your experiences.